I welcome you again to anatomy snippet number 12, first arch syndromes MCQ discussion. Here I'll be discussing 3 MCQs with all of you. I request you to first see the video on the first arch syndromes review, that is anatomy snippet 11, before seeing the video on MCQ discussion. Secondly, I would request you to read the question as I am reading, but then do not see the answer immediately. Pause the video, think of an answer yourself, commit to that answer, and then see whether you got the answer correct or not. Immaterial whether you got the answer correct or not. It's more important, according to me, to review the question. So let's get going with anatomy snippet 12. This boy's condition developed from abnormal development of which pharyngeal arch? A, second, B, fourth, C, sixth, D, first. Okay. So based on reading the options only, not even focusing on the question, I know that the question has come from a pharyngeal arch. And in the question, they have asked me, this boy's condition developed from abnormal development. So basically, the question is asking me some clinical features of a pharyngeal arch. And then I have to know whether which pharyngeal arch is contributing to these prominent clinical features. So the keywords here are 2-day-old boy. Usually the pharyngeal arch syndromes are seen in children. More often than children, we can also say infants. Underdeveloped jaw, sunken cheeks and small ears. Eyes angled downward, that is down slanting of the palpebral fissure. Absence of eyelashes on the lower lids. These three things actually, sunken cheeks, down slanting of eyes or the palpebral fissures, and absence of eyelashes on the lower lids, they are diagnostic of Treacher-Collins syndrome. If you remember Treacher-Collins syndrome, let me briefly review it for you in 10 to 15 seconds. It is a first arch syndrome which was discovered by Edward Treacher-Collins in 1900, autosomal dominant condition which occurs due to the mutation of TCOF1 gene and presents with the following clinical features. So the answer to this question is D, first. Moving on to the next question. Which of the following best describes the embryologic origin of the portion of the tongue? A, fourth pharyngeal arch, B, first pharyngeal arch, C, second pharyngeal arch, D, third pharyngeal arch. So based on reading the options alone, I understand that this question has come from pharyngeal arches. Reading the last line of the question, they're asking me the embryologic origin. So that means this question is a core question of embryology and not really a question of the clinical features like the last one. So here the keywords are 45-year-old woman, loss of taste sensation. We all know taste is a special sensation out of the 5 primary sensations that we have, and that the nerve supply of the anterior 2/3 of the tongue is responsible for taste. They have given that the swab is placed on the midline portion of the anterior third of the tongue. So yes, my guess was correct that this has to do with the anterior thirds of the tongue. So anterior thirds of tongue in embryology, they have a very special place. If the question was not related to embryology, then simply the answer would have been our anterior 2/3 of tongue. So chorda tympani nerve, branch of facial nerve. And then you will be easily misguided and you will mark the answer as C, second pharyngeal arch. which unfortunately is a wrong answer. Because they have asked you the embryologic origin, the embryologic origin is slightly different. The thing is, the anterior part of tongue or the anterior thirds of tongue is responsible for taste. Agreed. Taste prominently from the anterior two-thirds of tongue. Agreed. So the anterior part of tongue develops from two lateral lingual swellings and one midline swelling. Now that midline swelling is called as the tuberculum impar. Now what happens is, as time progresses, these two lateral swellings fuse into that one single midline swelling, because of which there is a single projection or a single structure. Now, embryologically, the nerve supply of the anterior thirds of tongue comes from the first pharyngeal arch, comes from the branches of the trigeminal nerve, to be specific. So that is why the answer to this question is first pharyngeal arch and not second pharyngeal arch. That is why it is instructed by our teachers to us students, because we all are students at the end of the day, to read the question properly and avoid silly mistakes. Moving on to the last MCQ of the snippet. This boy's condition may be explained by abnormal development of which pharyngeal arch? A first, B second, C third, D fourth. Okay, so this, reading the options alone, I understand that this question has come from pharyngeal arches. Not just that, I also understand that this boy's condition, so that means they might have given me some clinical features. So the first is 2-day-old, again an infant, to be precise, neonate. Difficulty feeding, tongue retraction. Yes, we have learned about tongue retraction with cleft palate and underdeveloped mandible or mandibular hypoplasia. So these three clinical features are very, very diagnostic of Pierre-Robin syndrome. Let me review Pierre-Robin syndrome for you in 10 to 15 seconds. Pierre-Robin syndrome is a first arch syndrome which occurs due to the mutation of SOX-G gene on chromosome number 17, which has an incidence of 1 in 10,000, whereas Stretcher Collins had an incidence of 1 in 50,000. So Pierre-Robin is more common. And the three diagnostic clinical features that present with Pierre-Robin syndrome are already present in this question. So this makes it a clinical vignette of Pierre-Robin syndrome. So first pharyngeal arch. I thank you all for patient listening. If you like the video, kindly like, share and subscribe. If you have any comments or any suggestions or corrections, please send us a mail on our official mail ID, bmcquizingsociety@gmail.com. Thank you.